My name is Dr Ian Strawford and I'm the Medical Director at Skin Excellence Clinics in the southwest of England, and I'm going to talk to you about the treatments that we offer men at our clinics.
Do you see men regularly at Skin Excellence Clinics?
The answer is yes. We now see men much more frequently through both of our clinics. When I started in aesthetic medicine nearly 15 years ago, men were very rare. We might see them occasionally for maybe a mole removal or something dermatological. But increasingly, we're seeing men now for a whole range of cosmetic, hormonal and wellness concerns. And I would say that men make up at least 25 to 30% of the patients and more that we're now seeing through the clinics.
What concerns do men usually present with at clinic?
So men are presenting to us with a variety of problems. As I said, traditionally men would be presenting with problems with their skin, especially unsightly moles or skin lesions or lumps and bumps that they're wanting removing, which we've been doing for many, many years. But I think I'm seeing men coming through now who are more concerned about their facial appearance, which is really important to them. And, you know, men are wanting to stay looking good and looking healthy as they age. And equally, we're seeing men who are wanting to maintain hair. So hair treatments are very popular now with men. And I'm seeing men for health-related issues around hormonal health and sexual health. So we've been doing for many years treatments such as the P-shot to help with erectile dysfunction. But we're also doing treatments looking at men's hormonal health and looking at supplementation where needed there. But I think the biggest change we've seen is in facial cosmetic treatments. So patients coming for Botox, fillers, and skin rejuvenation treatments.
Men and women are different. How do you address the male patient when considering facial treatments?
So when I'm consulting with a male and we're looking at potential treatment plan from a facial aesthetic point of view, then men tend to present with problems such as looking tired, looking run down, probably with hollowing underneath the eyes, but due to a bit of volume loss in the malar or mid-face area. So that's something we're often addressing. We're looking at whether we need to restore lost volume. But for a lot of men, the main problem is actually their jawline. And as the male jawline weakens or may have started off quite weak, by that we mean that there's a big difference between male and female jawline. So a male jawline tends to be more square and a wider chin. And a female jawline is much more slimmer, more V-shaped with a high cheekbones. So we have to take these sort of anatomical differences into account, because it would be very easy, certainly when we're using fillers or collagen stimulating fillers such as a Lancet, to create a more feminine appearance for a male. Equally, we can do the same in a female. So we're conscious about addressing the male face in a male way to keep men looking more masculine. And I think that's really important when we're doing treatment. The same when we're doing Botox. So Botox is very popular in men. So again, we're treating maybe the forehead lines and wrinkles, but equally, we're maybe treating the frown lines and muscles. Now, a male brow sits lower than a female brow, and that's a sign of masculinity, whereas with a female, we're looking for a nice arch brow, lifting the eyes, opening the eyes. So again, we have to be careful when we're using Botox. We want to maintain that masculinity with the muscles of the face and achieving. So we have similar goals and desires, but to get the outcome we want, we have to specifically focus that treatment to a man. And I've been doing male treatments for many years now, and often will lecture around the country on the differences between treatments between men and female. So it is very important to get it right, so we make men look refreshed, a little bit more youthful, more masculine, or to keep their masculinity. And I think those are really important crevices. And men want good skin, you know. Often men have suffered with acne and suffer with acne scarring and the deep pockets of and a loss of tone and texture of the skin due to previous acne scarring. So again, we have some very effective treatments for treating acne scarring, such as Morpheus 8 and Tixel and polynucleotides. So we can improve the male skin. And men are looking at treatments to actually maintain good skin. So actually some of our topical skincare is getting quite popular amongst men as well, because men's skin needs looking after. We need to cleanse properly, we need to nourish the skin, and we need to protect the skin from the sun if we want to maintain good skin. So I think across the board, when we see men, we're looking at all of these things now.
What is the male andropause?
So, the male andropause, this is much to my heart. So we know women suffer with a menopause, and there's a lot of talk about the menopause and how that can impact on women and the treatments for that. But men suffer an andropause, and I'm glad to say it's a more gradual transition into our andropause. So it can start from an earlier age, but most men may start to see the symptoms of the andropause in their 40s and 50s and 60s. So what is the andropause? So effectively, the male hormone testosterone, which is usually in high levels when we're young men, will drop slowly as we get older. Okay, there will be factors that will influence the drop of testosterone, such as obesity and other illnesses. Stress is a big factor. So it's not uncommon that men may get to their 40s and 50s and 60s with symptoms of testosterone deficiency. These symptoms, they may be gradual onset, but they include things like fatigue, the putting on weight, especially around the middle, so that change to their body status, maybe the difficulty of putting muscle on. They may be losing some of their interest. That could be their drive, their sort of ability to get up and go feeling. So they may lose sexual interest, and they may even be suffering erectile dysfunction. So these are all symptoms of the male andropause, as we call it. It's easily checked for. So at Skin Excellence clinics, we do a range of hormone testing where we can look at not just testosterone, but the other hormones that are important for men. And we can supplement, if necessary, with testosterone and other hormones to support the andropause. And I've many men who've come through the clinic and we've treated, who we've really put a spring back in their step, and they are feeling so much better, more energy, more youthful again, just by correcting the male andropause.
Why should men choose Skin Excellence?
So men should come to us, really. We're a medically led, care quality commission regulated clinic, both of our clinics. So we offer the highest standards of medical care, whether we're dealing with hormonal issues, wellness issues, hair loss, or facial aesthetics. You're going to be assessed by one of our doctors, and we take in the whole patient, the holistic view of the patient, even when we're doing aesthetics, because nutrition, health and wellness all play a part. And we can offer safety, and also that we're offering the most medically advanced treatments that we can deliver, that we know are effective, and we'll find the bespoke treatment plan for you that's going to work for you. And that's an individual thing. So it's very important to have a really thorough initial consultation with one of our doctors, and then we can design that program for you and treat you in a medical setting, which is discreet, safe and friendly.